Hey, we're going to go ahead and start this webinar. We are delighted to have Dr. Lois Wagner with us today, one of our esteemed faculty advisors. We're going to be hosting the third in our series of colloquia. And today's theme, of course, is the primary care clinic administration. We're delighted to have, I know we have some of our scholars online as well, and we encourage your participation. But before we actually get started, I want to just mention that I have unmuted everyone, but I would request that you mute your phones so that we do not hear your background noise. I know that Dr. Wagner is going to be offering, encouraging discussion at the end of this webinar, at which point I will again unmute you, and you can unmute yourselves and participate by audio. You can also send me chat questions down there at the bottom hand of your screen. You can send either Dr. Wagner or I questions by chat if you prefer to do it that way rather than use your audio. So with no further ado, I will turn this over to Dr. Wagner. And again, we are so grateful that she is with us today. And Dr. Wagner, can you hear me?
I can hear you.
Terrific.
Yes,
Thank you for being with us today. I will turn it over to you.
It's a pleasure, and welcome to everybody who's on the webinar. This, again, as she said, is the third webinar in this series. And in this webinar, we're going to concentrate on scholars who did their work in the area of needs assessment, evaluation, and client satisfaction. What I'm going to do in this seminar is first introduce the scholars, because after all, it is their work that's being presented here, not mine. I'm simply moderating this colloquia. I'm going to introduce them, and I will then present their projects. And we do have 10 projects in here, so unfortunately, I've had to condense a lot of information into some very brief talking points. Fortunately, it looks like we do have some of the scholars on here, and they will be able to jump in and defend their work. I'm going to then give some reflections on this, and then I'll open it up for discussion. I want to introduce the scholars, and I know that some of them are here today, as is Adrienne Bast. She did her project at Matthew Walker Comprehensive Health Center in Nashville, Tennessee. Itala Brown, who worked with the United Health Services in Nashville, Tennessee as well. Nick Cudjoe, who I believe is also on the line, who worked with Watts Healthcare Corporation in LA. Alicia Ellis, again, I believe Aisha is online. She was at Adelante Healthcare in Phoenix, Arizona. Hal Flowers, again, Hal is online with us. He was at Central Mississippi Health Services in Jackson, Mississippi, as was Christy Goodman, is also online with us. Rebecca Ives worked with Adelante Healthcare as well. Tony Jackson, who I'm hoping will be joining us today, was also at the Central Mississippi Health Services Center in Jackson, Mississippi. Michelle Strong, who was at St. John's Well Child Family Center in LA, and Emily Wang, who was also in LA at the Northeast Community Clinic there. I want to start with talking about presenting to you the needs assessment projects, and I grouped 3 of them within here, and I want to say this is an interesting bunch of topics, and I want to present each in turn briefly, and then we'll go on to the next topic. The first project that will be presented here is that of Adrienne Bast. And again, she was at Matthew Walker in Nashville, Tennessee. She is a medical student, I believe. And she was at Matthew Walker Community Health Center, which is I believe it is the first qualified health center in Tennessee, and it's here in Nashville, Tennessee, which is where I am right now. She gave some background on the population there, which was predominantly female, which turns out to be true at many of the community health centers. 43% of them were Black or African American. You can see about a third of them were Caucasian, and about 20% Latino or Latina. As you'll see in many of these community health centers, Many of the people who attend there, in this case almost 70%, were below the poverty line. They had a concern about patient access at the Matthew Walker Health Clinic, and she determined that this is such a short time frame for these projects that she felt it might be useful to look at some of these issues surrounding the program and the population, how you might go about establishing some community relationships with there, and then have this information available to future scholars who attend these programs, maybe to give them a leg up on what they're doing. And I think many of the scholars identified this as a very compressed time frame in which they need to get their projects going, and I know they hope to leave a legacy when they leave. The method that she used is she distributed Spanish and English patient surveys, and her focus was on barriers to access, transportation, internet and social media, program needs, and their willingness to participate in programs. She was able to distribute and get a return of 50 surveys on this, and she found that about 38% drove to clinic, meaning that there was a pretty high percentage of people who couldn't drive to clinic, and they were dependent on bus and taxi or maybe walking. And although 72% lived within 30 minutes of the area, this still presented a burden for many patients trying to attend these clinics. As a result, about 37% said they were not willing to attend programs at the site, and they preferred the brochure method, that kind of thing, or access to the Matthew Walker website. However, only about 28% of the people in her sample were able, even had internet access in their home, and about 40% were using Facebook. So what she decided to do, with the advice of some of the people at her site, was to create some information packets that might be used about programs and distribute them during their clinic visits, and also make data available on the Matthew Walker website. And I think this is important information because it is such a compressed time, and our scholars do need to have a leg up on what is going on there. I'll let her address some of these issues later as we get to this. Alicia Ellis was the Adelante Healthcare Center in Phoenix, and this was a little bit a different patient population. Aisha was interested in integrating sexual health and STI prevention information in the primary care setting. She found that, and she was particularly interested in HIV testing and services. She found that Phoenix was disproportionately affected by HIV. They had a high number of infections, but also a high number of unknown infections. And she was interested in looking at the barriers existing between patients and provider, which may inhibit HIV screening. A large patient population, over 40,000 patients, and they serve a lot of migrant workers. 52% are Hispanic and Latino, and you can see that about 30% are Caucasian. A much lower level of Black and African American clients are seen at this place. And again, 75% below the poverty level. She was in the evaluation of HIV testing trends in this organization, and she had to identify methods to increase HIV testing. She did some secondary analysis of their electronic medical record from several of their clinic sites to determine if HIV services patients were receiving HIV services they needed. And she used ICD-9 coding, look at viral disease, HIV status, and HIV counseling to gather her sample. In findings, she found that about 3% of the HIV sample that she looked at had been tested, and she had found that 50% in the OBGYN clinic had been tested. That, of course, patients in OBGYN clinics it is recommended by the CDC that they all be tested for HIV. So she determined that the testing rate was relatively low, and made some suggestions to the organizations, which they were happy to receive. And she suggested that perhaps providers should increase the number of HIV testing screenings for HIV that they could do at clinic to enhance case finding. She recommended that they obtain a sexual health history at each annual exam, and actually suggested that they add a sexual health history screen in their EMR. Also recommended providing training on HIV prevention to the staff, how to obtain a health history, particularly sexual health history, and she found some issues with respect to proper coding of HIV so these data can be tracked. And she began to develop policy regarding HIV testing, or that the organization should, for the purposes of and also develop a secondary prevent plan. I'm going to move on to the next one, which is Hal Flowers, again, who did an assessment of community need. He was at the Jackson Hines Comprehensive Health Center, large FQHC in Jackson, Mississippi. I believe this is one of the first comprehensive health care centers that was established in the United States, along with another up in, I believe, Massachusetts. And he went in and talked with the